Welcome to another nursing mindset video. Today's nursing mindset is one drug, different bodies, different responses. One of the biggest misconceptions in pharmacology is believing that medication or that a medication will affect every patient the same way. But in reality, medications don't just depend on the drug. They also depend on the patient receiving it. So here we look at age, body composition, organ function, pregnancy, even breastfeeding, and how they can all change how a medication behaves in the body. As nurses, we don't simply ask, what medication am I giving? We also need to ask, who am I giving it to? That's the nursing mindset. So let's think beyond just the medication. Imagine two patients receive the exact same medication at the exact same dose. Now, one is a healthy 25-year-old, and the other is an 82-year-old who has decreased kidney function. Should you expect that same response from the medication for both patients? Yeah, probably not. Now, imagine giving that same medication to a newborn, or a pregnant patient, or a breastfeeding mother. Again, the response may be completely different. Now, the medication hasn't changed, but the patient has. So that's why understanding the patient is just as important as understanding the medication. We have to understand, right, the body changes throughout life. So throughout lifespan, our bodies change in ways that directly affect medication safety. Some organs become more efficient, while others become less efficient. Body composition changes, protein levels change, liver function changes, kidney functions change. And all of these changes influence how medications are absorbed, distributed, metabolized, and excreted. Instead of trying to memorize every age-related change, ask yourself one question. How might this patient's body handle this medication differently? That single question encourages clinical judgment rather than just memorization. We have to individualize our patient care. Safe medication administration isn't just about treating everyone the same. We shouldn't be treating everybody the same. It's about recognizing what makes each patient unique. So for example, with pediatric patients, you're thinking about developing organs, weight-based dosing, and reducing fear during medication administration. On the flip side, with older adults, you're thinking about decreased kidney and liver function, medication sensitivity, falls, and polypharmacy. With pregnant patients, you're thinking about both the mother and the developing fetus. With breastfeeding mothers, you're considering how medications may affect the infant. Notice what all these patients have in common. None of them require a completely different nursing process. They require you to adapt that nursing process to meet their individual needs. So here's the question every nurse should ask. Before administering any medication, pause just for a moment and ask yourself, what makes this patient different? Do they have decreased kidney function? Are they taking multiple medications? Are they an infant with immune organ systems or immature organ systems, I should say? Could this medication affect a developing fetus? Could it be transferred through breast milk? When you start asking those questions, you're no longer thinking only about the medication. You're thinking about the whole patient. So here's my final thought. As you continue learning medications throughout nursing school, remember that the medication is only one part of the equation. The other part is going to be the patient or the person receiving it. Safe medication administration means recognizing that age, development, physiology, and individual patient factors all influence how medications work. So before every medication, don't just think about what you're giving, think about who you're giving it to. When you understand the patient, you'll make safer decisions, anticipate potential risks, and provide more individualized care. Understand the patient, consider the lifespan, deliver safe medication care, because that's the nursing mindset. Keep developing yours.